So it's a great opportunity for me to learn from you all. So please, even before that, I would like to know, are you able to hear me well?
Yes, sir.
Great. So yes, so please, you can, I can see there are quite good number of participants, almost 50. So just I would like to know your background or the institute you belong to, or you all are from MUJ, Manipal University, Jaipur. Are you all from Manipal University, Jaipur, or from various institutes?
We are from basically various institutes right now.
Great.
Other than MUJ have joined already.
Thank you, Hemant. So, okay, we will discuss with each other as we proceed. I can share my presentation. So, are you able to see my slides?
Yes, sir, it's visible.
Good. So, these were some pictures from the university or the city I'm presently based in. That's the University of Malta. So today we will have a talk on the topic. I'm sure you already aware about this. So intelligent approaches for the pandemic outbreak management lessons and the way ahead. Okay, so well, everyone is aware about COVID-19 outbreak and they are trying to protect ourselves from this outbreak. And unfortunately, many were not that lucky to protect themselves, and things are still gloomy. And many countries, or in fact, the whole world is struggling to deal with this outbreak. So, what are the learnings we can have? But more importantly, how AI and machine learning can contribute to this? Well, I prefer the word not AI, but it's called EI, extended intelligence, because now the development is showing it is far beyond than human intelligence, the capability these traditional AI systems have extended to. So we can better call them extended intelligence. Okay, so before that, something about the country I'm presently in and the university. So I'm based in Malta. It's a tiny island country in Mediterranean Sea, and it's almost 7,500 kilometers from Jaipur. I have visited your lovely campus, Manipal, Jaipur, a few times. Yes, before pandemic. So there is some comparison between India and Malta. So as I told, it's very tiny country. So the population, so you can see it's India having almost 3,000 Malta. Okay, or the population of India is 3,000 times than Malta, and area is 10,000 times than Malta. So but the best part is the life expectancy, which is among the highest in the world, second highest in Europe after Monaco. And then Human Development Index is also quite high, and unemployment rate is among the lowest in Europe and second lowest in the world after Qatar. Even after pandemic, it kept its unemployment rate quite low. Well, nobody can predict what might happen in next few years because world is gonna change due to this pandemic after effects. GDP being a tiny country, it's having a small GDP compared to India. So it's almost 150 times GDP India has. Okay, while GDP per capita is quite high, so it's almost 15 times than India GDP. And health spending is even far more than India. So even per capita health spending is quite high and percentage of GDP is quite high. So per capita health spending is almost 40 times than health spending in India. So you can see the quality of healthcare Malta has, and why I'm discussing we will see quite shortly. Okay, so you can see the comparison of health spending in Malta and in India. Ironically, this health spending is contributing to the GDP growth quite a lot. Okay, so you can easily see why per capita GDP is quite high in Malta thanks to health spending as well. Um, Traditionally, Malta has priority of health. Okay, so even at the time of 14th century, or the time of Black Fever, Malta was the first country which identified infectious diseases as infectious, okay, or contagious. Okay, so Malta started developing techniques to deal with such infectious diseases, and they started separate rooms outside the towns, so they keep those infected outside the town. And another strategy were they were wherever they find someone infected, they put a cross. Okay, and that helped a lot at the time of um, plague outbreak as well as Spanish fever. So Malta was not that affected by these infectious diseases just because of the strategy they developed. And thanks to Malta, it spread across the globe. Okay, so Malta was being used to treat war. Those were getting casualties during war across Europe. During Second World War, Malta was the place where they were transporting injured um, uh, military personals to get treatment here. So you can see that helped a lot this country, and health has been the priority. And that experience also helped us to deal with COVID-19. Initially, we dealt it brilliantly, even for few months. After first wave, we were having almost zero cases. Now the second wave is again there, and it is affecting us, but not as badly as many other countries. So other than health, okay, Malta is considered the world capital in iGaming. Before 2010, almost 90% of internet games were licensed in Malta, and now still 60% of internet games are licensed in Malta. It is also the world capital of blockchain, DLT, and cryptocurrency. So if you are dealing in cryptocurrency, the exchange might be based in Malta because most of the cryptocurrency exchanges are headquartered in Malta thanks to its liberal policies towards blockchain DLT. And Malta is the first country in the world which recognized blockchain and DLT in its regulations. Okay, so the world is following Malta for these regulations. Then it is a hub for offshore banking and a favorite location to short films. from both Hollywood and Bollywood. So if those are following Game of Thrones, might have seen Malta or Thugs of Hindustan, Charas or Bharat movie. All these are filmed in Malta and many more. So why artificial health intelligence? That's the idea we will discuss here. Okay, and as I told you, more precisely, I would say extended health intelligence. Okay, so not just artificial, but extended, because it is extending human intelligence multifold. Okay, so well, in artificial health intelligence, we are also combining many other future health technologies like AI, ML. Okay, we are discussing sensors, cloud computing, telemedicine, mobile health, robotics, gene editing, genomics, epigenomics, proteomics, and metabolomics. Okay, so all these are possible thanks to extended health intelligence or artificial intelligence. Okay, and at the same time, another enabler for these technologies is globalization, as well as another is economic growth. Okay, so and these are the regions, globalization and economic growth, responsible for the spread of COVID-19. So these are enabler at good side to improving our health, but as well as another side which we were not able to predict or forecast. So that side was a little bit gloomy and the world is suffering with this pandemic. So why? Okay, so we can take an example of COVID-19. So we need an efficient mechanism or system for acquiring, collecting, analyzing, and sharing information from different domains of the complex system for decision making to fight COVID-19 and monitor the progress. That is, we need artificial health intelligence, okay, or extended health intelligence. Okay, so to understand further, we have to understand what a complex system is. Okay, so many entities are interacting with each other. That's a complex system. So it is not easy to understand a complex system, and that is what happening with human intelligence. Human intelligence is not very efficient in understanding such complex systems. I can give you some examples. Okay, so for COVID-19, why it is a complex system? Because it is not just a medical problem, but it is a social problem. You might have seen how society is getting affected. It's a political problems. Many world leaders are losing their position just because of this outbreak, how it was handled. It's a cultural problem. We have changed our culture. Now we are not shaking hands. Community problem. Okay, so community shape has changed since then. Communication problem, transportation problem, management problem. Okay, so it's a big challenge as a management issue. It's a supply chain problem. Many countries are blaming that due to supply chain this COVID-19 is spreading. So, and also supply chain got affected badly due to COVID-19. Administration problem, education problem, and you are studying from home, or many institutes or universities are still not open physically. So financial problem, well, we have seen how economies are getting affected. Many have lost their jobs. And economical problems, so we have already seen the world GDP has contracted due to COVID-19. Behavioral problem, psychological problem, geological problem. So you can also easily understand, if we deal this problem well without considering just medical part, but other parts like using lockdown and all these administrative strategies, these might be more effective than solving it or treating patients once they got infected. And we can save more lives by using efficient strategies than just treating the patients. Okay, so to understand this such a complex system, okay, human intelligence is limited. We need high performance compute intensive systems to analyze data and see what strategy might work the best. Okay, we can simulate, and yes, many countries are simulating that. But yes, this is a paradox. If you have, Adam and Eve story, that was very well. Okay, that's a biblical story, but it is respected by all the religions. Okay, so Adam and Eve were in Eden Garden, and they saw a fruit, but that was a forbidden fruit. God told not to eat that fruit, otherwise there will be a curse. But they tried to eat that fruit, and because of that, all problems we are facing. Okay, so what was that fruit? Well, according to this book, or okay, so this biblical story, it is called the fruit of knowledge. So knowledge is the root cause of all problems. Is that true? Well, yes, if we find human intelligence which is limited, yes, knowledge is the root cause of all problems. If we do not know there is COVID-19 outbreak outside, we will be happier. Okay, and then even if we die, we will die happy because we do not know. So that's knowledge is a problem. Like if you know there is COVID-19 outside, you will try to protect yourself, your family, and everyone, and you will be very much worried. So you are losing your happiness or bliss. So in that way, yes, but can we utilize knowledge to extend human intelligence to deal with these problems? So not one solution is very simple, not to know about the problem and you will be happy. Another solution is to deal with a problem, solve that problem and you will be happy. Earlier we were deciding the first part, be unaware about the problem and be happy. But that is affecting indirectly. Okay, like someone is not aware about COVID-19 and getting COVID-19 and seeing the consequences, then how can he or she be unaware about these consequences? Well, religion is saying forget about everything, so and still live your life happily. That's methodologically or theoretically that's good idea, but practically no. Your suffering will make you aware about these and will take your happiness. So to be happy, we have to utilize this knowledge to deal or to solve the problem. So what is that utilization is beyond human intelligence, and that's called extended intelligence or more popularly artificial intelligence. So we can see one of the application, another. Okay, so based on that it was told where ignorance is bliss, it is folly to be wise, as Thomas Gray told. And that even now, we carried out a survey and we found those who are not aware about political developments are happier than those who are aware. Okay, but at the same time, their life expectancy is far less than those who are well aware about what is happening in the world. And they are living more healthier life. So you have to decide if you want to live happier life or healthier. But yes, if you continue progressing, you can live both healthier and happier life and longer. Another example we can take is how artificial health intelligence can help, or okay, artificial intelligence can help us. So this is a famous story of Della and James. Okay, so both were in love, but both were poor. So they wanted to gift each other something. They decided to sell their possessions to buy the gift for their companion. Okay, so Della was having beautiful hairs. So James wanted to gift her a hair clip, and James was having a old watch, so it was broken. So Della wanted to gift him a wristband to replace. Okay, so but as they were poor, so they sold. Okay, so Della sold her hair, got cut her hair, and James sold her watch to buy gift for each other. When they met, love was blossoming. So love was in the air. So this was a happy ending. Was it really a happy ending? That's my question. And I tried at my home, and for me, it was not that happy. It resulted in this or in this. So what was wrong? Well, they were not aware about what is going on at other end. So they were having ignorance. So was ignorance a bliss? Yes. Considering human intelligence capabilities, yes, still ignorance is bliss and it was a happy ending. But if we were aware about what is going on at other end, we might be happier. So how to do that? Well, there are tools available. I'm sure you are attending this FDP, so you might be aware about human behavioral modeling. So you can model how a person will respond to a situation, how the person will react in that situation. So you can better know human behavior. Then modeling the effect of others' behavior using game theory. Okay, so you can also understand your behavior and others' behavior well using game theory and will make the right decision considering others' behavior. Modeling of cultural, social, economical, financial, and environmental effects or impacts using big data analytics. Among these, the most difficult is most modeling spontaneous changes in sentiment. Well, this has been now proved. What are the factors affecting our sentiments? So the most important factor is hormones, which is getting affected by weather. Okay, so we are able to do that at some accuracy, not very accurately. Okay, but yes, progress is or research is going on to progress in that direction. And even more important is to find out the difference between reality and perception. Unfortunately, human intelligence is based on perceptions, not on reality. Okay, and that's why we call it ignorance is bliss, because perception might not always be true. Your perception might be the biggest perception which is responsible for this COVID-19 outbreak. COVID-19 can affect everyone else, but not me. Even if I do not use any protection or COVID-19 appropriate behavior, but still it will not affect me, it will affect all others. That's our perception. But reality is different. Everyone is the same for COVID-19. So we have to find out this difference between perception and reality and how to do that. That's a big challenge. Okay. So machines are brilliant in seeing the difference between reality and perception. Okay. Because this is a very complex system, or any system we see is very complex system. We trust more our perception than trying to solve or to understand that complex system through reality. Okay. To explain this better, even in epic novel or epic book or our religious book, Srimad Bhagavad Gita, we have a chapter of Abhimanyu who entered, okay, but was not able to come out because he was having perception that he is aware about all the parts, but reality was different. So based on that, it was suggested then karmandeva adhikaraste ma phaleshu kadachan ma karmphal hetu bhurma sango astri karmadi, because at that time human intelligence or intelligence was limited to the human capacity. So we cannot understand better the relationship between cause and effect, or we cannot control that relationship. So this is thought, but yes, with human intelligence extended by machines, we can move little bit further controlling the outcome, although still we are far behind than reaching the point where we are able to control the outcome completely, but at some extent. Okay, so now another problem, okay, why this is reality based perception, or what is the problem with human intelligence, well explained by hill climbing algorithm, which is the first artificial intelligence algorithm. I'm sure you all are aware about this hill climbing algorithm. So when you start climbing from here, you can see only up to this. So you might feel this is the maximum peak. You have to reach only here. But once you are here, you will realize, oh, there is another peak. That is the maximum or global peak. So you need to start moving and reach here. Okay. Similarly, if you want to reach the bottom point, then you might feel this is the minimum point one can go. But once you are here, you will realize, no, there is a point which is even lower than this point. Okay. So you can see human intelligence is limited to or abstracted to local maxima and local minima. We can't see this point from here, and that's the problem with human intelligence. So you can easily see this is local maxima, is a global maxima is our perception, but reality is no, there is another global maxima. That is what happening throughout the 1.5 year or 2 years of COVID-19 history. Every time we feel that, okay, if we do this, it will control COVID-19 completely without realizing there is a global maxima. In the sense, there are many factors which are affecting this. So without controlling these factors, we try to implement strategies, and that is creating a big trouble. We can take another example, which is our economy. If you all are from India, you can well understand how this fight between perception and reality happening, with many demonstrations which are based on just perception without even being agreed to accept reality. Okay, so you can see this. Okay, well known formula: more demand than supply, more profit. We do not see beyond that. But is that true? Well, if you see or you are satisfied with local maxima or local minima, yes, this is true. But in reality, there is further. So more profit means more attractive industry. More attractive industry means more players. More players means more supply than demand. So means less price, less profit. Okay. Less profit means some will leave the market with loss. And then this is the cycle. Now, many do this mistake, very big mistake, and that's made them suffer with losses. Okay. While if you are clever enough, you will need to be beware of this when there is a big gap between demand and supply. Definitely, if you enter in the market taking advantage of that, you will lose. You have to see the market dynamics further, not just one step, but many further steps. You know, the chess playing. If you see what might be the next move of the opponent, only that, then you might not win. Okay. I have seen many players just, there are novice players, okay, not good players. Okay. They try to just kill as many as from opponent side as possible. Okay. While without having a proper strategy to reach the end. Okay. So game theory is saying, okay, when you decide a move, what might be the best move for the opponent, and if opponent is deciding that move, what might be the move for you. You have to see many steps further. Okay. And based on that, you can ensure winning the game of chess. Okay. So that theory is called game theory. Okay. You might have also seen many other AI algorithms. Okay. Like A star and all these are considering, or min-max are considering these theory. Okay. So these are basis for game theory. Okay. But game theory is more extended. So initially machine was not able to win against the best player. Okay, because that best player has already extended his intelligence by practicing, but then machine started extending its intelligence further. So the best player was able to see next 9 or 10 moves, or predict, but machine was able to see next 24, 30 moves, and now it is able to see even next 50 or 100 moves by using supercomputer. Okay, so you need lot of processing power, and human intelligence is limited to processing power, so it cannot have infinite processing power. It has a limited processing power, so we have to extend that processing capacity of human by using machine intelligence. So as this topic is related with COVID-19, we have to understand our healthcare system and what was wrong with our healthcare system during this COVID-19. So the same way, okay, many people demand, okay, there should be, okay, just better price you should get for your produce, without realizing if this is more profitable at the end, it will be a big loss for you. If it is less profitable, okay, then there will be a barrier for entry for other players, and you will be able to get consistent or stable profit. Okay. So, and that is a big problem you might have also seen easily, and unfortunately, many are even not ready to accept the reality. They are working for their perception, and if someone is trying to show or to help them with the reality, they are refusing, and that is what happening. Okay, a classical example is farmers protest. You can easily see in India, but many, and another example is COVID-19 outbreak. Okay, because human intelligence is not able to accept thinking or accept the reality. They are still happy with their perception, and for them this is called ignorance is bliss. So we have two types of healthcare systems: public healthcare system and private healthcare system. In India, we have both public as well as private. In Malta, also we have public and private healthcare system. But in many countries like the UK, Canada, we have only public healthcare system. While many other countries like the US, we have only private healthcare systems. Some other countries are having little bit mixed strategy where these systems are supported by insurance. Like in France or Italy, you should have a private insurance if you want to access the healthcare system there. Okay, so that's the compulsion there. Okay, in the US, it is not a compulsion. You can have private insurance or you decide not to have that, like in India. Okay. So in private healthcare system, some patients want cheap healthcare and some patients want best luxurious healthcare. Okay, so many hospitals are even better than 5-star hotels. Like when I was in Singapore, I have seen there are facilities better than 5-star hotel. Okay, so these are not for just treatment; these are for luxury, and these developed a new system which is called health tourism. Okay, then health providers want maximum profit. So how to get maximum profit? Simple. Maximum profit means maximum hospital visits and maximum readmissions. Okay, plus, so maximum hospital visits means maximum readmissions as well as maximum hospital duration of stay. So if you are charging a patient based on how long a patient is staying or how long a bed is occupied, then duration of stay is playing role. And if you are charging them how many times patient is coming to the hospital, then readmissions are coming in picture. To deal with readmissions, we have insurance system. Okay, but we will see how insurance system realize that readmissions are helping insurance system as well. So they also want more readmissions. Now, more readmissions means when a patient is discharged, he is not fully recovered. Then on, if he is fully recovered or she is fully recovered, readmissions will be less. So this strategy is not completely cure a patient, or there are side effects. Okay, so side effects are helping these healthcare systems. Okay. Before you move to a conclusion, let me tell you one more thing very interesting about healthcare systems. Worldwide healthcare systems are contributing, and related services are contributing up to 38% of world GDP. If you follow any stock exchange, especially Nasdaq or European stock exchanges, okay, then you will realize the heavyweight companies are, most of these are insurance companies, okay, or healthcare companies, medicine companies, okay, or healthcare services companies, okay, hospitals companies. Okay, so healthcare is contributing a lot. Now you assume you are able to reduce the cost or healthcare cost, okay, by some percent. For example, I don't know, you reduce the cost by 30%. If you are able to reduce that cost by 30%, means if it is contributing 38% to the GDP, means in the GDP, this will be almost more than 10% of contraction. Okay, world GDP, and that 10% of contraction might be catastrophic, might affect everyone. Okay, millions of employees will lose their job. Many economies can completely collapse, and many might die hunger or depression or many other problems. So it is not that easy to just reducing the cost. So we can see these private healthcare systems are contributing a lot to our economy. So it is not directly. Okay. There is another catastrophic impact of that is if these hospitals are not profitable, what might happen? These might close down. If these are closing down, you might not get healthcare even the level which you were getting earlier. So you cannot say these should not get profit. That's what we do not realize, and the human has done many mistakes like that earlier. Even like in case of wars, they do not real, or terrorism, they do not realize those who are involved in that, they are not having any other employment than these. So if they resolve one war or one terrorism problem, it might occur somewhere else because they do not have any other employment. So the same thing is here. If hospitals are not profitable, what might happen? There will not be many hospitals, and many already hospitals will close down. Another even bigger problem is this healthcare profession might not remain lucrative. So many parents will not send their children to opt for medical profession. Okay, so another is, okay, like in European countries where children are taking decisions themselves, they will not go for this profession because this is not profitable. So at some point you will have huge shortage of healthcare professionals. So you cannot just solve it by reducing the profit. No, that's not a solution. You have to think it very cleverly. Okay, and that's where human intelligence is not sufficient. We need very sophisticated models through extended intelligence or machine intelligence. Okay, so at the time of COVID-19 pandemic, what happened? Okay, yeah, one more thing I should tell you about this private healthcare system. For getting profit, they are running at 90% or even more capacity. Now there is one more problem, let me tell you. Okay, if you start a hospital, you will employ some of the experts, surgeons, and all these. For example, you employ a surgeon, you do some mathematics and see, okay, the surgeon's salary in country or general salary, I don't know, 100,000 rupees per month. Okay, for that 100,000 rupees, if you need, I don't know, like you are charging for the same surgery to a patient 20,000, then you need 5 pieces. Not really, you need instruments, you need hospital, what you call, expenses or rent and other charges. Okay, so there are many more charges. Like in the US, the biggest charge is legal fees. Can you imagine, for healthcare, biggest charge is not salary or medicine, it's a legal fee in the US. Okay, so here, okay, so you do some mathematics and you realize you need at least 40 patients to pay the salary of a surgeon. What will you do? You will fix a quota for that surgeon to have at least 40 surgeries every month, okay, or maybe little bit more if you want to have profit. Now what if these many patients are not, or these are many surgeries are not required? That's another problem many countries are facing and many hospitals are facing. So we need to have a holistic solution of these problems as well. Now at the time of COVID-19 pandemic, should they make more hospitals and employ more health professionals? Can they make more hospitals instantly, and can they employ more health professionals instantly? How can they find more health professionals? We have already seen health professional shortage across the globe. So how can they have more at that time? Even we have seen not just health professionals, but resources, for example, oxygen. How can you instantly have that much oxygen? Or all right, if you have, what will you do once COVID-19 is over? Okay, another very interesting story happened in India is, because India is the largest manufacturers of medicine, so there was a medicine remdesivir. Okay, during the first wave in India, they found that remdesivir might be required in large quantity, but so they started huge production of remdesivir. In December, they realized cases are going down, but the production is too high, so they started destroying these medicines. You might not imagine, large quantity of medicine was destroyed, then consumed. Okay, and many medical companies got bankrupt just because of huge production of remdesivir. But then when the second wave came, there was a shortage of remdesivir. Although in on November 20th, 2020, WHO declared that remdesivir is not helpful in COVID-19 pandemic, or it should be avoided, but still it was being prescribed during the second wave. That's quite surprised. But at the same time, you might realize the reason for that prescription, or that too much demand for that medicine, was the shortage of that medicine earlier. If there was not have been that much shortage earlier, then there might not have been that much demand. Okay, so we were only thinking as a human intelligence only next step. We didn't realize the further consequences of that next step. Okay, so we were working, or we are making decisions based on our perception, not based on our reality. Reality is considering many further steps, not just next step. So another complex system, okay, or another type of hospitals are public healthcare systems. Okay, so you might say the problems with private healthcare systems. So you might definitely say public healthcare systems are better than private healthcare systems. Well, let's see. So in public healthcare system, the main motive is everyone gets the same healthcare. Even if you are a prime minister of the nation or you are a small worker or even you are unemployed, you will get free and equal healthcare. We have seen that in the UK and Canada when I was working there, or even in Singapore at some extent. So health providers want minimum cost. Minimum cost means, okay, why minimum cost? Because it is funded by taxpayers' money. Okay, so minimum cost means limited resources, least duration in hospitals, and minimum admissions. Okay, so in a previous case, we were seeing maximum admissions in private hospitals, but while in public hospitals, we want minimum admissions and least duration in hospitals. Okay, while if we fixed a number of admissions to a particular threshold, then there will be a waiting list because the healthcare resource demand is not uniform for every day. It is varying. Someday you might have more patients, someday you might have less patients. Okay. And also, if the population is growing or new outbreaks are happening or whatever reason, there might be even that demand increasing. So there will be a waiting list. If the demand is not increasing, then there will be a fixed waiting list. But if demand is increasing or we are having more complex diseases, okay, then this waiting list will ever increasing. Many countries like the UK and Canada are struggling to deal with this waiting list. You can see the situation is so bad that many patients are dying while waiting to be seen by the doctor due to this waiting list. When I was working in the UK, this was the target given to us to reach 9 hours waiting time for admission and emergency and 3 weeks waiting time for um, what you call long-term illness or chronic diseases. Okay. So, but unfortunately, many hospitals were not able to even reach 18 hours waiting time maximum limit. Okay, so 9 hours was too far for them. Okay, and there are many diseases like stroke, heart attack. You need immediate medical attention, and unfortunately, many patients were sacrificing their life just because of this waiting list. So you might say, okay, we tried to discharge patients earlier, okay, so that there might be more beds available or beds might be free quickly. But then we realized we did a study. Okay, not I did. I say I used that data, and the president of Geriatric Society in the UK did this study for 16 years to see the impact of early discharge or various strategies, late discharge, early discharge, and we realized early discharge means more readmissions and it is not helping. Like we need more beds than discharging late. Okay, so that was not helping. Okay, so we have to come with a sophisticated strategy. That's what we found, a particular point for discharge. So not early discharge, not too late discharge. Okay, so longer waiting list. Okay, so you can see, and longer waiting list means poor health care. Poor healthcare means public outcry. Okay, now how to solve that? As I was telling you earlier, everyone will get the same level of healthcare. So everyone will need to wait. Now this is another problem when there are two patients which need to wait the same time. Okay, and you are not able to decide which patients should be given preference by any means, okay, or which patient should be treated first, then you will lose a lot of time in making this decision. Actually, this is NP hard problem and you cannot solve it. Okay, so that's another problem. So what you will do is you will come with preference system. Now, sometimes that preference might be a very logical and sometimes this is illogical. Okay, because even with preference, if you find two patients are having the same preference level, then again it's difficult to decide. Okay, and when there is a shortage of resources or waiting list is ever increasing, okay, so everyone will not get the same healthcare, and you might come with some other preference systems like the medical professional is my relative, my friend, or I am the minister, or I am the richest person in this island, so that will be corruption. So preference is a solution, but it is also called corruption. So health providers want minimum cost. Okay. Now, as we have already seen with this corruption, there might be wastage of resources. Okay, so even if we do not use preference system, many resources will be underutilized because decision time will be too much. Okay, so that might defeat the purpose of public healthcare system. And unfortunately, many big public healthcare systems are struggling to deal with this situation. So you might easily say, to solve this problem, very simple, you have to add more resources. More resources mean more cost. All right. I carried out a survey in the UK and many elderly patients were saying they are ready to pay more tax if they are getting better healthcare. But will more resources really help? Well, see, more resources means short waiting list. Short waiting list means longer hospital stay. Okay, as we have already seen, so minimum readmissions. So that's a good thing, minimum readmissions. Okay, but more patients being treated as well as there will be more patients look for healthcare. Okay, why? Because waiting list is also working in favor of reducing the number of patients accessing the healthcare system. So like if you have some ailment which is not urgent or you do not actually need healthcare or to be seen by the doctor, but just because there is no waiting list, you will say, okay, why should I go to a medical store? I can just go to see a doctor. And then, okay, so there might be some underutilization of resources, as well as there was another problem we have seen in many countries. It is called care holidays, where like if someone is taking care of some elderly or some dependent or some other type of patients where they are dependent but they do not need medical care. Okay, so we call them care homes or nursing homes. Okay, these nursing homes are not like nursing homes in India. Okay, in India nursing homes also provide medical care, but in other countries they do not provide medical care. They are just taking care of the person who is not completely independent. Okay, so what will happen is, you will, if there is a waiting list, there is no chance they will get admission to the hospital if they are not having any ailment. Okay, or even if they are having ailment, they have to wait long. But when there is no waiting list, some might artificially develop ailments so that they can get admission to the hospital and the carer might get some relief. Now that might be sometimes these artificial ailments developed artificially might be fatal. Okay, so many patients might just die because of these. Okay, another problem with longer hospital stage, even surprising, you might be surprised to understand, 1/3 of the patients dying in the hospital are not because of ailment, they are because of medical errors. So more leniency, more medical errors. Okay, some patients we call it bed blocking or discharge delay. Some patients are dying just due to discharge delay. So that might increase. Okay, and the even bigger problem, which is responsible for at least 18% of patients' death at the hospital, is called hospital acquired infection. Okay, so HAI. Okay, so hospital acquired infection means There is no infection a patient is having, but when he or she was admitted to the hospital due to, I don't know, lack of cleanliness or due to other patients in vicinity, he or she is getting infection. Earlier, COVID-19 was actually hospital acquired infection, at least in Malta. Initial patients who got COVID-19 is at the hospital. They were at the hospital when they got this COVID-19, and that was fatal. Many patients just got killed because of that infection, because they were highly vulnerable, and that is why they were at the hospital. But unfortunately, due to infection, they had to. Okay. Now another problem, even in India, we have seen initial cases of HIV. Medical professionals might get this infection and they might spread that infection not only to the patients but also to their family or the community. So that's another problem. Another third type of problem is there are some infections which are only at the hospital. They are not outside the hospital. And these infections again might have new strains and might suffer community badly. Okay, like herpesvirus and all many other viruses are there. Okay, so many countries tried to add more resources, like especially in the UK, they doubled the health spending, but it didn't help at all. Okay, that created even bigger problems. So by modeling that or simulating that in machine, we might have a better picture. Instead of applying strategies and seeing the impact, we can do lot of simulation. That is what we were doing, and see how various policies, various strategies might work, what are the other things, other issues might occur, what we might need to do, and more importantly, what might be the optimum solution. So misuse, more cost, some waiting list will create. Okay, so we need optimum resources, optimum waiting list, optimum hospital stay, minimum readmissions. Okay, optimum patients number, optimum utilization. Okay, minimum misuse, optimum cost, and some waiting list. Now, there might be many other strategies like we were working on, and we realized we also have to see financial impact. Like if you discharge a patient early, okay, and in the community he or she needs care, okay, then what might be the financial impact of that? So if you just see healthcare, some policies might be good, but for the economy, these policies might not be that good. So you have to see a holistic picture, how it is affecting everyone in the community, not just patients. Okay, so like if you can make a policy which is brilliant for the hospital, but it is badly affecting the community, that's not a good policy. So as we have seen, human intelligence is limited, so we can make policy very good for hospital but affecting community, or very good for community but affecting hospital patient. But with machine we can have highly extended or almost infinite intelligence to deal with all such issues. So optimum resources means we need proper planning, continuously adding resources if population is increasing, changing, or population dynamics is changing. Maybe like if there are more elderly, then they might need more resources. Okay, so if life expectancy is increasing and population is still constant, then still we need more healthcare resources, so we have to continuously add. So for all these problems we need resource requirement forecasting. Okay, that is what we do through intelligent systems. We have to do admission rate estimation and length of stay estimation. So all these can help. Now again go to COVID-19. So at the time of COVID-19 pandemic, what should we do? Should they make more hospital and employ more health professionals? Now this is another a big question mark. Where will you get these more healthcare professionals when the world is struggling for healthcare professional shortage. Okay, so can they make more hospitals and employ more health professionals instantly? That's another issue. Okay, so what can be the solution in such a scenario? Okay, you have to see. Okay, in military, okay, not only in India, many countries, there is a system where when there is a war, then everyone is asked to fight or to register for fighting as a soldier. Okay, in time of peace they are doing other professions. Okay, like even in the US this is the law. Okay, and in many countries like Singapore everyone is getting military training. Okay, so at the time of war if we need we can ask them to serve the nation, otherwise they are doing their profession. Can we follow such a strategy in case of infectious disease or in case of healthcare? Now, here there is another very interesting thing, and I think in the next slides, yes. Okay, so we have that. Okay, when there is a war, you are fighting against another nation. So you know everyone can fight together, okay, to another nation, or maybe another part. I don't know. Okay, but when there is a disease, everyone need to fight independently getting help from doctors. Okay, so it is not like everyone is fighting together. Okay, it's quite different. So in that case we can have even a bit different strategies to deal with. So one strategy is hotel industry is using that. So instead of booking a hotel room you can buy a hotel room. So what it will do, if you buy a hotel room, you can stay there anytime as well as whenever there is some like you are not staying in that room, so that room is vacant, so that can be leads to other occupants and the earning can be shared by you. Okay, can we use such a strategy in case of healthcare? Like if you are making a new colony or building, you can have healthcare services available there, and instead of using it regularly, whenever needed you can use that. So that's extended services. Okay, you might say clearly insurance services are like that, but again insurance services are limited and they are working, if they are continuously running, so they are working the same way other hospitals or healthcare systems are working. So we need some strategy beyond that. Okay, another is we are which is called home care or telemedicine, which is having infinite capabilities. Okay, so for home care, when we build our house, you know, we can consider that. For example, building a house is costing, I don't know, few million Indian rupees. Okay, and healthcare services might need a few 100,000 Indian rupees. So it's better to allocate some resources there. So in case of emergency, you can utilize these. So these are some new evolving strategies we can use. Obviously, I can't say which strategy is good because we have to do simulations. We have to find out with these artificial intelligence systems or extended intelligence systems which strategy is most beneficial. Okay, and what are the various issues might occur because of these strategies, because whatever I'm saying is again this is perception at this point, the reality might be different, so we have to see that or to understand that reality through intelligent systems. Okay, so in addition to these there are some other global health challenges which we might see, and health industry might need lot of resources and intelligent systems to deal with these. So those who are interested to make their career in health informatics or in health intelligent systems, might consider dealing with these issues. Okay. So one is obesity and chronic diseases. Okay. Due to obesity, there are many chronic diseases, so these are highly linked. Another is aging. That's a good thing that we are having high life expectancy, but at the same time, the problem is more aging population, so more health resources required. Do you want a break in between? Or should I continue? Because I know attention span is only 20 minutes, but I have already exceeded 1.5 hours. Yeah, so let me know. Do you want a break or should we continue?
So we can continue this.
Okay, thank you. So another big problem is drug resistance, hospital acquired infection, and medical errors. Now, I have already discussed hospital acquired infection and medical errors. If you combine both, you will realize almost 40% of the uh, patients dying at the hospital are due to hospital acquired infections and medical errors. Now, another big problem coming in near future is drug resistance. It is expected that drug resistance might be responsible for 50 million casualties annually in next 50 years. Okay, so after 2070, okay, recently there is a paper published. If we do not find a solution of drug resistance, then this might be responsible for 50 million deaths every year due to drug resistance. Now, the solution of drug resistance is personalized medicine. So instead of giving drugs whenever there is a problem, you will find the optimum quantity of drug which is not making resistance, and that optimum quantity is highly individualized. So something optimum for me might not be optimum for you. Okay. Another is, and that's called healthcare 5.0, which is talking about not curing patients but preventing population from disease. Okay, so you can make highly innovative systems, we will see shortly, where you can ensure they will not, or they will live their life healthy, they will not need health care. Okay, they will live life, so healthcare after getting ill.
Hello, Lalit sir. I think muted yourself. Please unmute.
Sorry, I
Yeah,
don't know
thank you.
how that happened.
Uh-huh.
Okay.
Yeah.
I'm not sure what you have missed. Okay, so global warming and pollution. Okay, I can say if you are medical professionals, you might better understand that pollution, especially NO2, is resulting in more inflammation. So those who are infected with COVID-19 are having less chances to survive if there is more pollution. Okay. Health inequality and healthcare finance. So again, COVID-19 has proved you cannot be healthy if your neighbor is not healthy. Okay. Or someone unhealthy in, I don't know, Africa or in China can make you unhealthy in India or Malta. So COVID-19 has proved that. So your health will not depend on you, but it will depend on everyone's health. Okay, so healthcare inequality is going to be the biggest issue in next few years, and for that, healthcare finance. So how to ensure finance available for ensuring health equality. Okay, and infectious and zoonotic diseases and viruses because of global warming, pollution, and human development, like their natural habitat is animals' natural habitat is taken by humans, so they are roaming around spreading diseases. Okay, another big issue and which needs even more attention, and I will tell you how it is increasing, is stress and sleep apnea. Okay, which is responsible for many lives these days. And another very new domain is coming, which is called relationships and social health. So sometimes your health will depend on your spouse, your relations, your parents, I don't know, okay, your friends, as well as social harmony. Okay, if there is a stress in society, you might get affected by that, and that might affect your health. Okay, so that is the new domain of medicine coming, and again this will need intensive data analytics. So all these are the domains which need intelligent healthcare systems. So for dealing with these future healthcare technologies, I think I have already discussed these technologies. Okay, so yeah, at the beginning I have already discussed. So these are intelligent systems, then storage systems, then novel computing architectures, and then 5G or 6G. Okay, so for data transmission, okay, and telemedicine and sensor networks. Yes, at the beginning I was discussing sensor networks and all. All right. So now we will see some more inside of COVID-19 to better understand its impact and the lesson learned from it. Okay, and then I will discuss some of the projects we are working on related to COVID-19 and healthcare. Okay, so we can see here Malta is having more than 80%, yeah, more than 80% of the population had both vaccine dosage or fully vaccinated. So those are not fully vaccinated are less than 12 years of age, because vaccine is not yet available for those who are having less than 12 years of age. Okay, and those who are having 12 year or more age got fully vaccinated, and we have started from today third booster dose. Okay, so not only two doses, but the third dose is also being given to patients or to the population to protect against new variant of COVID-19. So it was thought earlier that population density is responsible for more spread of disease, but here it is showing clearly population density is not having any direct or indirect significance or relationship with the spread of disease or death rate. Okay. So in fact, very low population density or very high population density is having less fatality per million. Okay, while 100 people per square kilometer, or we can say 10 to 100,000, sorry, 10 to 1,000 people per square kilometer range, most of the countries are there. So it is not having any statistical significance with the death rate, okay, or spread of the disease. So what is having significance? Interestingly, GDP per capita is having great significance, and it is quite surprising. Countries with high GDP per capita are having high fatality rate. a high number of cases. Yes, this is number of cases. So you can clearly see those countries who are having low per capita GDP are having low number of cases. Okay, while those who are having middle or high per capita income are having high number of cases. This is number of deaths per million. So again, it is showing the same thing. Countries which are having low per capita income are having low number of deaths, while high are having high number of fatalities. Anyone can suggest why is that? What is the reason for that? Because that's a big lesson from COVID-19. If you are rich, high fatality rate. If you are poor as a country, low fatality rate. Any idea? Okay, so let me tell you some interesting observations. Okay, one is because of high income, life expectancy is high, and those who are having some ailment cannot survive in low income countries but can easily survive in high income countries. So many those are surviving are having other comorbidities, or there is a high elderly population. And as you are already aware that COVID-19 fatality rate is directly proportional to the life expectancy or age. Sorry, not life expectancy, the age. So if there are more aged population, then more fatalities. Okay. So that is, and the another big problem there is their healthcare systems, which are running at very, like they were highly stressed. So they are running at their full capacity. So when there are more cases, there were no healthcare services available, or we cannot extend healthcare services. So access to healthcare services became a challenge. For example, these days in the US, they are having more oxygen shortage, or the situation of oxygen shortage is worse than we were having in India during the second wave. Okay, so even being the developed or one of the most developed countries in the world, they are having high oxygen shortage, similarly high bed shortage and other shortage, and similarly in Japan. Okay. Now here, okay, so this is earlier we were saying that if we do more testing, then there will be less deaths. Okay, but this statistic is showing this might not be true. Okay, and this statistic why there are more cases in high income countries. That is because there is more testing in high income countries. Okay, so there are more cases diagnosed. Another thing is the definition of case is different in different countries. For example, in India, a case, someone infected but not having any symptom, is not considered as a case, while in Malta, someone infected without any symptoms is also considered a case. Okay, so this is the same in many developed countries. Okay, now why COVID-19 is dangerous? Again, this is quite contradictory, but this is the fact, because it is having low infection fatality rate. Means very small proportion of those getting infected are dying. Okay, so that is less than 1%. And also low case fatality rate, means case means those diagnosed positive. Okay, so it might look quite contradictory, like if high fatality rate is there, then more patients will die and it should be more dangerous, but this is not the case. We have seen Ebola or SARS-1 or SARS-2, SARS-1, yes, when the fatality rate was quite high, so the disease became quite localized. There is another psychological reason is when there are more there is more fatality rate, public is more cautious, okay, and governments are taking more stringent measures, okay. Another is high incubation period, so up to 14 days. So someone infected might easily spread the infection in these 14 days without his or her knowledge, okay. High number of asymptomatic cases, okay, so many were having no symptoms but spreading the disease. It spreads by droplets or airborne, and in fact, even now we are not sure, or scientists are not sure if it is droplets or airborne. Okay. Another is global supply chain and the aviation sector growth. Well, I have explained all these in my recent book on COVID-19. That is my second book on COVID-19. Okay. Another interesting fact is economic impact of COVID-19. Okay, so this is also showing how this is not a medical problem. Okay, so 5.2% contraction in global GDP in 2020. Okay, we have already seen that 2021 data is not there, but if there is a contraction in 2021, things will be even worse. Okay, so this contraction in GDP might result into 10 to 15% increase in depression, anxiety disorder, and suicide rates. Frankly speaking, that data is based on 2020. If you also consider 2021, then that might go to up to 25% or even more. Okay. So that might result in 2 to 5 million extra suicides in 2021 alone. Okay. And more than 10 million suicides in future due to COVID-19. Okay. So, and that data is based on GDP contraction in 2020. If you also consider 2021, then this number might be more than 20 million. Now, so far, COVID-19 officially fatality is 4.5 million. That's official. Unofficially, many studies are saying that might go up to 10 million. But you can see the economic impact might affect at least double of that number. So only considering it as a medical problem might not help. It is a big economic problem as well. Okay, so we have to see, and many countries are even still struggling, which should be the priority, health or economy. Well, this is clearly showing health. If you do not give priority, then economy might get affected and vice versa as well. So you have to make sophisticated models to find out which policy will be most helpful, which will save the maximum number of lives. So another learning from India, okay, I took Indian data and I don't know, there were many other data from India which I can present you, but I'm not sure if we have sufficient time available. So I quickly give you some glimpse of data, why there was second wave and why that second wave was more fatal than the first wave. So not only in India, everywhere we are facing second, third, fourth, fifth wave. But we have to understand how COVID-19 is spreading. Okay, to understand that. So those who do not know COVID-19 exists can spread. Those who know but do not believe, those who unknown about protection measures, and those who know but do not follow to show their distrust. Okay, so the last fourth level is the biggest culprit against spreading this disease, because those who do not know COVID-19 exists might be at a place where there is no COVID-19, so they might not need protection. Those who know but do not believe, yes, these are the second culprit, so they might not follow protections and spread this. Those who unknown about protection measures, well, these might not again spread much because either there are not many cases, so there is not much information about protection, or the protections are not available at all. Okay, so because protections are not available, just because the disease is being controlled by some other measures, so they might not spread. So second and fourth are spreading maximum. Okay, but for second, even in Malta, we have seen many demonstrations asking not to have vaccine, but fortunately, everyone got vaccinated. Okay, so, and similarly, uh, there were demonstrations against mask. Even in the US, we have seen many demonstrations against mask, and now they are those who were demonstrating this against mask are suffering with this. So condition is very bad because government removed mask requirement and things were out of control. Okay, so the problem with India is during the first wave. Okay, even when there were lot of restrictions. Okay, in fact, India was having the most stringent measures in the world. Okay, so the lockdown was too strict, but still priority was given to movement or economy, then health. So during the second wave, believe me, those got affected or got killed due to COVID-19 were those who were involved in this movement during the first wave. So they lost in both manner, economically and health wise. Okay, so their employment got suffered, and the biggest problem was that made the first lockdown useless, because these migrants were moving from one place to another, taking the disease with them. So there was no purpose of having such stringent measures. Okay, because disease is still spreading very fast. Okay, even faster than if there were no any other there were no lockdown or anything. Okay, so there might not be that much movement, so people might not spread this disease. Okay, so therefore there was no lockdown or no strict lockdown during the second wave, and that affected, and even there was no benefit of having any lockdown or anything during the second wave. Okay, now, so to deal with all these situations, as I have already told you, behavioral analytics might help, but there are some other medical domain are evolving. So one is predictive and prescriptive analysis in healthcare. So you have to predict health status, disease risk and response based on information already available. So disease risk is also considering behavior, social dynamics, political dynamics, and everything. Then predicting the positive and negative impact of various factors, including genetic makeup or genomic profile, present health status, environmental factors like weather, pollution, geography, diet and medicine, sleep, stress, lifestyle, activities, including contact tracing, exercise and therapy, relationships, social and economic status. So if you can see lot of data we need to analyze through these intelligent systems, but fortunately we have such intelligent systems which are doing predictive analysis in healthcare. And that's why now we are not, earlier the buzzword was patient centric care, but now with health 4.0 and 5.0 it is population centric healthcare. Okay. So, okay, we can see this video. I don't know, we have time, so okay, I can skip this. Okay, now one step further to that, we are having prescriptive analysis in healthcare. Okay, this came like, okay, we were having this project here where with the airline like, okay, airline maintenance company Lufthansa Technik, okay, where they are getting aeroplanes for maintenance. But we realized by analyzing their data, okay, those are getting a particular type of maintenance are coming back after some time for some other type of problem. Okay, so there was a pattern. So we realized that pattern, and then we suggested that whenever there is an aeroplane is coming for maintenance, you not only maintain that part, but you have to also consider these problems and treat them even before they occur, so that they might not need to go for maintenance again, because that is affecting a lot. If there is an aeroplane which needs maintenance, okay, then you have to have another aeroplane on lease that might cost millions of euros. Okay, so can we apply that in case of healthcare? Yes. So we have to do predictive maintenance as well as present status analysis of the patient, and based on that we have to prescribe what the patient should do in the future to ensure the best of their health. Okay, so we have uh, developed strategies or prescribe strategies to control environmental factors. Okay, so you might ask how to control weather. Well, if weather is not suitable for you at this place, then you might need to move, or you might stay outside, or you might stay inside. You have to use air conditioner or not. Similarly, pollution, geography, similarly diets and medicine. So here, interestingly, the analysis can tell you if you continue this job which is providing you higher salary, okay, considering your healthcare cost, or you have to move to a low salary job to another place, but the benefit is in terms of cost cutting in healthcare, okay, or production. So simulation models can suggest that diets, medicine, what diets you should say, medicine, sleep, stress, all these treatments, surgery, gene editing you need, medical tests you need, precautions and monitoring. Okay, so all these things will do. Monitoring will help to change these prescription at go. Okay, so whenever there are change in our monitoring systems outcome, then we can make changes in our prescriptions to ensure optimum health. Okay. So I don't know, we have time for that, so we can skip these videos. Okay, so then there is another very interesting development, one step forward than this prescriptive maintenance, is called digital twin. So everyone will have his or her digital twin. Okay, so making and keeping your digital copy containing all required information about you together with your 3D image or scan. It can also contain your general information like height, weight, shape, BMI, etc. Your genomic profile and phenotype, your medical history, your family history, health related, your diet, activity, travel history, your predictive or prescriptive analysis. Okay, so what happens is, and that is quite helpful in case of COVID-19 type of pandemic or outbreaks. Okay, so you need not to go to the doctor, you just share your digital profile, which is a digital twin, and doctor will do analysis on that. Even they will see the impact of various treatments on that, and based on that they will find out the best treatment, and they will prescribe you that treatment or therapy or whatever. Okay, you need to go to the hospital only if there is a surgery or some treatment which needs direct contact. Okay, so you might save lot of hospital beds, you might avoid many health issues. Okay, so right, I'm not discussing these, okay, because of lack of time. So some intelligent systems for COVID-19 outbreak management we have developed. Okay, so one we developed in June 2020. Okay, so this paper published on August 28th, 2020. Okay, anonymity preserving IoT based contact tracing model. So this is not only tracing human movement, but it is also tracing movement of any moving object like animal, vehicles, because disease might spread through these. Now many were having problem using contact tracing because they find it threat to their privacy or anonymity. So this system is based on blockchain and preserve their privacy. Okay, and another problem with the other traditional contact tracing systems like Arogya Setu you might have used is they are draining your mobile battery, or you can use only if you are keeping mobile with you. But this is RFID based, so you can just have a RFID tag with you, which is quite small. Okay, even you can fix it on your shirt or clothes or your vehicle or anywhere. Okay, and it is highly cost effective. So it leverages on blockchain's trust-oriented decentralization for on-chip data logging and retrieval, and allows moving objects to receive or send notifications when they are close to a flagged or probable or confirmed diseased case or flagged place or object, so that they can take protective measures. Okay, and these are technical details, so it takes only less than 1 second deployment and call time for a smart contact. Now this is being extended, so where we can also trace those who are not having this RFID tag with them. Okay, so it can help deliver a notification for mass isolation while preserving individual privacy. It can easily identify clusters of infection contacts. Okay. So it can also be used to better understand human connectivity. So how everyone is interacting, so how they are spreading the disease. Model similar other infection spread network, develop public policies to control the spread of COVID-19 and finding super spreader, hotspots, responsible behavior, where you should do shopping and all these. Okay, so that's block diagram, all right. Okay. Then I was talking about earlier digital twin. So for these or prescriptive medicine, we need disease network where we can see how disease is spreading, okay, through this contact tracing. So we can design this, we can monitor that network if there is a change. Okay, then we can track, we can share this information, we can analyze to develop policies, we can see the impact of policies, we can learn, predict, and prepare accordingly. Okay, we can also develop patient life log, okay, and share this. Okay, so that's part of digital twin, as we have already seen. So medical history, travel history, activities, behavior, and family history. Okay, so we have published this paper, as I told you. Okay, that was in IEEE Access. So a masked image recognition system where we can recognize a person wearing mask. Okay, and this is consensus based system. So those who are wearing mask because of some other reasons to protect their privacy will not be identified, but only those who are ready to reveal their privacy will be identified. Okay, now it is also location based or vicinity based, so it will ask your permission as well or consent, as well as it will analyze images only in a particular vicinity, so it need to compare with only few images. So it is extremely fast. Okay, so you need not to remove your mask to show your identity. Okay, so it is also using blockchain model for cost-effective image as storage and retrieval, machine learning and AI recommender system for image recognition and user interface. Another is healthcare self-service kiosk where you can go through many tests which do not need medical professionals intervention directly. Okay, so and then this is self-cleaning or self-sanitizing. So you can get these tests, and then based on these test results, it can allocate you or it can keep you in triage so that the right or most suitable medical professional can be allocated to see you. Further, if you need, and many patients do not actually need medical attention, so it can easily find out if you really need a medical attention or without any particular medical professionals attention, you can get recovered. Okay, so it can save many beds and resources. Okay, so it is using Raspberry Pi lightweight server. Okay, so that's the block diagram. Okay, another is has hospital bed occupancy and requirements forecasting, as I have already told you. Okay, so how it can help. So we are using historical data to predict how many patients of various ailment, various profile we might expect at a particular time of the day and particular day, particular year, if we need a new hospital facility or not, how beneficial it is. We can also see if we change the policies, how the number of patients might affect it. Okay, so all these things. Okay, and also we are considering length of stay in the hospital, so bed occupancy and availability. So this is in parallel collaboration with Nanyang Technological University and Tan Tock Seng Hospital, Singapore. So in an extension of this is we are also utilizing satellite data, weather station data and air quality data to find out the number of patients we might expect and the length of stay so that we can better prepare health services to ensure optimum healthcare delivery. Okay, so we are taking all type of data as to ensure prescriptive medicine. Okay, so as I'm saying, we are dealing with data. So the biggest problem was missing data. Okay, so sometimes data is not properly collected or it was missed due to some reasons or there were
Sir?
errors in that. Yes.
Hello,
Hello.
Lalit sir. Sorry to interrupt you, sir. Actually, sir, we have a session at 3:30 again, sir. So,
Yeah,
sir,
so in
like,
2 minutes I can
oh,
conclude.
okay, fine, no problem, sir. Because we will have sir question answer round also. Like, if
Yes, yes. So
part,
just in 2 minutes I can
yeah,
conclude
yeah,
this.
no problem. Okay, sir.
So we have developed a web-based system, so even you can access that to impute missing data. Okay. So like here, these are missing data, so you can impute and it can give you the values which were missing. So it has many applications. Okay, these are the papers we have published based on that. Then this is medical decision support system for managing acute upper grade gestational bleeding. So here what we are doing is we are trying to analyze all the data collected by the hospital. So whatever input was available at that time and what was the decision taken by the medical professional. So this is knowledge management system so that we can train medical professionals to develop new and new cases and asking them to take decision. Then it will be compared with the decision taken by the computer. Okay, and if there is something discrepancy in these decisions, then we will ask the expert to find out which decision was correct. If the decision by the student was correct and the system's decision was not correct, then we will use reinforcement learning to improve the learning of the system. So this way, slowly we can assist medical professionals so these systems can take decisions themselves, so become more autonomous for medical decision support. Okay, another is HIV disease progression modeling. So similar to COVID-19, this is HIV disease. Some patients are responding well to the treatment, some are not. Also, this is a big question when the antiretroviral therapy should be given to the patients. So we are analyzing data, large data. So all patients admitted to the hospital in last 23 years at Instituto Superiore di Sanità, Rome, not admitted actually, connected with that system and because HIV patient need not to stay at the hospital unless they are having other comorbidity. So all the test results we took and we analyzed and we found out, we developed the models to find out the best time to give antiretroviral therapy to predict how these patients will respond to the treatment. Okay, what might be the optimum treatment and all these things. Then we are also doing some neuroimaging so neuroimaging type of research, and where what we are doing is we are analyzing EEG and fMRI data Okay, so this is combining them. Another was epileptic seizure prediction. Another is Alzheimer prediction. Okay, so we are the first group in the world predicting epileptic seizure. Okay, then another is predicting neurological disorder by social media, like by face change in facial image, change in video, voice, change in your social media pattern, like using words, which type of keywords you are using, and all these. Okay, so this is in collaboration with Jivaji University Gwalior. So these are some of the projects we are working on, but there are many more. So you can go through my list of publications to find more. Thank you very much indeed for your attention. It's long time, 2 hours. I can understand it's quite boring, but now I'm here for questions if you have any.
Hello.
Yes.
Sir, thank you very much for your this informative session. As you said, it's not boring. It's very interesting to hear from you that you are working on these type of basically disease which are basically non-curable in this world. Thank you very much for this session. Now I would like to uh, have some questions from the participants. You can raise your hand. I'll allow you for the questions. Hello, if you have any queries, please raise your hands. Okay. As such, I think there is no query, sir. So once again, Lalit sir.
Thank you very much indeed,
Thank you.
and all the very best to everyone for their career, for their research, and feel free to ask me or contact me if there is something we can collaborate or you need my help.
Yes.
You can always browse my papers or other lectures you might find on internet. Then this lecture was just to demonstrate you how this healthcare industry is developing in collaboration with extended health intelligence systems, okay, or artificial health intelligence systems, and what are various opportunities in this domain. So if you are interested in any of these opportunities, you can always explore. So again, all the very best for your career and all your future endeavors.
Hello, sir. I think we have one question.
Yes.
Mr. Purushottam ji, would you like to ask some?
Sir, how to apply sir PDF in LA University? Postdoctor, sir.
Okay.
Sir. Hello.
Yes.
Sir, my sir.
Yes, Purushottam ji.
Yes, sir. How to apply PDF in
At our university.
sir, yes, sir.
Well, this is quite straightforward. We advertise all PDF positions because all these PDFs are based on the project we have. So you can see on our recruitment website. Okay, even I can share with you. And then you can apply if you find some position suitable for you. And then there will be an interview that might be again virtual interview. Okay. And based on your performance, they will decide.
Okay, sir. Okay, thank you, sir.
Okay, thank you, Purushottam ji. Anyone, please? Okay, as all the queries have been solved, so Mr. Lalit, Dr. Lalit, thank you very much once again for this session.
Pleasure. Stay safe,
Yes.
stay healthy, stay happy. Bye.
Yes. Sir, we wishes same for you.
Thank you.
Thank you. Thank you. Okay. This is the information for all the participants. Please be there in this team. The next section will be started soon. Okay, after 5 minutes.